What is the current situation of healthcare in Europe?
Healthcare organizations in general, and hospitals in particular, face a paradoxical situation. Healthcare expenditures still represent 10% of gross domestic product in many European countries because of known phenomena such as aging population, the rise of life expectancy, improvement of the quality of care, like survival rates to different types of cancer and technical equipments, and development of chronic disease such as diabetes, which imply long-term treatment. These phenomena result in more complex care pathways, and patients are more demanding. For instance, the average number of visits to health facilities in Europe is more than 6 per capita per year. At the same time, entities face budget constraints, cost cuttings, especially among public entities, and economic downturn. So hospitals can't just manage patients in and hopefully out, but they have to increasingly deal with them at multiple points of care pathways.
Why should patient relationship management be improved?
Firstly, the structure of care is changing. All the infectious diseases, all the high mortality and cancer is past. Today, chronic diseases require long-year treatment of patients in the same institutions. That means that a patient has an interest in good services and in good care. Take just appointments. You know all the hassle getting an appointment with the doctor by phone, timely, and there's no internet support for that in the most cases. From a hospital point of view, the interest is particularly getting better processes. In a study of 2011 in the UK, the NHS found that just 5.5 million no-shows created cost of €117 each. So this is enormous and tremendous potential. And secondly, hospitals can get a competitive edge by better services and better care for the patients in a competitive environment hospitals are today.
How could patient relationship management be improved?
Much can be done in a short time to deliver benefits for patients and hospitals on traditional channels like physical and telephone reception. Also, online appointments, reminders, navigation help in hospitals, or self-services improve services for patients. Then, on a more mid-term, a multi-channel approach is feasible by assessing the patient contact processes from a patient perspective. This means continual feedback from patients and families. This also means involving the staff, clinicians, in improving contact and engagement processes to find the right entry point into the healthcare system.
Do ministries of health or governments also have a role here?
Certainly they have. Not only, but specifically in Northern European countries, hospital-generated patient relationship management works best in competitive environments, particularly in Middle Europe. But all governments, particularly in Northern Europe, work on e-health programs offering these services. For example, the Choose and Book service in the UK generates the opportunity for each patient to have his appointments electronically. The portal Sundhed.dk in Denmark provides perfect information and a lot of transactions for patients, and so do a lot of portals in Northern Europe. So all the e-health programs we are driving in Europe are influenced or driven by patient relationship management principles, and BearingPoint consults a lot of those.